Dr. David Spiegel, I am so happy to have you on the program today. We're really honored. Thank you so much for joining
Thank
us.
you. Thank you, David. I'm delighted to be here with you.
You have so much interesting work, and I just want to start a little bit here, a little bit on your background. You're an expert on hypnosis, and you have an MD. You've been teaching and practicing for a long time. What interested you in hypnosis?
Well, David, I have to confess that it's something of a genetic illness in my family because both of my parents were psychiatrists and psychoanalysts. They told me that I was free to be any kind of psychiatrist I wanted to be, and so here I am. My father, when he was about to go off to be a battalion surgeon in North Africa in World War II, met a Viennese refugee who had learned to do hypnosis. He was a forensic psychiatrist who had a smallpox scar in the middle of his forehead. And he noticed that some of these prisoners he was interviewing would suddenly close their eyes and seem to go into some altered state. And so he started to learn about hypnosis. And because he couldn't serve in the U.S. military, he offered to teach Army doctors how to use it. So my father started using hypnosis to help with combat stress reactions, with pain. And he came back and was going to go back, and did go back into his psychoanalytic training, which was big at the time. But Freud had given up hypnosis, and he was sort of told, who are you to carry on with it, when Freud didn't. But he had a wonderful supervisor who said, you know what, don't feel so precious about what people think. You're going to teach a course on hypnosis at the Analytic Institute because I'm going to take it, so you better do it. So he did, and he kept using it. And he was the kind of guy who would follow up with patients after a while and see how they were doing. And he discovered that often he got farther with a few sessions of hypnosis than he did with 3 or 4 days a week on the couch. So he started shifting his practice. The dinner table conversations were pretty interesting. I got to watch him make movies of patients responding to hypnosis. So when I got to medical school, I figured I better take a hypnosis course. I did. And my first patient, I was on pediatrics at Children's Hospital in Boston. The nurse says, Spiegel, your next patient is in status asthmaticus. And I was following the sound of the wheezing down the hall. I didn't need the room number. And there's this pretty redhead, bolt upright in bed, knuckles white, struggling for breath. Her mother is standing next to me, crying. The nurse is in the room. They had tried subcutaneous epinephrine twice. It hadn't worked. They were going to give her general anesthesia and put her on steroids. And I didn't know what else to do. So I said, would you like to learn a breathing exercise? And she nods. So I got her hypnotized. And then I started to sweat because I realized we hadn't gotten to asthma in the course yet. So I said something very, very sophisticated. I said, each breath you take will be a little deeper and a little easier. And within 5 minutes, she's lying back in bed. She's not wheezing anymore. Her mother stopped crying. The nurse ran out of the room. My intern comes looking for me. I figure he's going to pat me on the back and say, what the hell did you do? He said, the nurse has filed a complaint with the nursing supervisor that you violated Massachusetts law by hypnotizing a minor without parental consent. Now, Massachusetts has a lot of weird laws, but that one is not on the books. And her mother was standing next to me when I did it. And he said, you're going to have to stop doing this. And David, this is the story with hypnosis. We don't get no respect. It's either silly or dangerous or both. And he said, and I said, why do I have to stop? He said, well, it's dangerous. And I said, you're going to give her general anesthesia and put her on steroids, and you think my talking to her is dangerous? I don't think so. So take me off the case if you want, but as long as she's my patient, I'm not going to tell her something I know isn't true. So he stomped off, and they had a council of war among the intern, the resident, the chief resident, the attending. And they came back on Monday with a radical idea. They said, let's ask the patient. I don't think they'd ever done that before. And she said, I like this. I want to keep doing this. She had been hospitalized monthly for 3 months. She had one subsequent hospitalization, but went on to study to be a respiratory therapist. And I thought that anything that could help a patient that much, violate a non-existent Massachusetts law, and frustrate the head nurse had to be worth looking into. And because I could watch it happen right in front of me. I could watch the degree to which she could regain control over her body. And 7,000 patients later, I'm still doing it.
Okay, so that answers my next question I was going to ask you. Is it effective? How does it work? And is it dangerous? We can skip that.
Yeah. Yes, no.
Okay. We're going to get back to hypnosis in a moment. You've also done a lot of work with cancer and cancer patients. And,
Yes, I have.
there's something about the title of one of your papers about psycho-oncology. So this is
Yes.
a phrase I've never heard.
Yeah.
Tell us, what is that?
Well, psycho-oncology is basically a medical discipline where people study how people react to having cancer, what are the best ways of supporting them through cancer, and what are some of the psychophysiological mechanisms that may have an effect on how people cope with it, how they live with it, how they sleep with it, and whether some psychological issues may have an effect not just on quality of life, but potentially on quantity of life too. So it's how do we understand and better help people with cancer live through it, live through the treatments, and live better and maybe even live longer.
Quickly, could you give me some ideas of some of the methods and protocols you've done to help people in this way?
Sure, David. We've done randomized clinical trials sponsored by the National Cancer Institute and National Institute of Mental Health, in which we take women, for example, with metastatic breast cancer. So these are women who've been diagnosed but now have had a recurrence of the disease, which is a more serious situation. And we randomize them either to get standard care with some education about cancer or to attend weekly group support. And I started this in the 70s at a time when it was considered a bad idea for cancer patients with advanced disease, especially to see one another because some of them were going to die. Metastatic disease doesn't always, but often results in death from cancer. Although it's interesting to note that more women diagnosed with breast cancer die of heart disease than breast cancer.
Right.
So it's
Yeah.
not always a death sentence by any means, but it is concerning. And so we got these women together. We would meet for an hour and a half once a week. They would talk about their fears. They would learn to better manage their emotion, to not be so suppressive of how anxious and sad they were, but to talk about it because they could see in other people that they found it comforting to be able to share their feelings and concerns. And even when the worst happened, when members of the group died, they were able to grieve the losses together. And death is not a novel concept to a cancer patient. It's not like, oh, I didn't know that could happen. Of course. And one woman said after being in the group for a while that being in the group is like looking into the Grand Canyon when you're afraid of heights. If you fell down, it would be a disaster, but you feel better about yourself because you're able to look. I can't say I feel serene, but I can look at it. And so these women strengthened one another. And we found over the course of a year that they became less anxious and depressed. Just being able to face it. They could see in other women in the group things they couldn't see in themselves. They would feel like I'm weak and too frightened and all this. And they would say, she's dealing with it the way I am. And I don't see her as weak or too frightened. I see her as coping well. And they felt less alone with it than they did before. So we found that over time in randomized clinical trial, the women in the support group were less anxious, less depressed, had less pain than the control group. They learned to control their pain with self-hypnosis so that a new pain in their chest didn't automatically mean to them that their disease was progressing. It meant they needed to do something to control the pain, and they did. So they had half the pain. And in our original study that we published in The Lancet, we found that the women randomized to support groups actually lived longer than the control patients by an average of a year and a half. There was no cure for cancer, but they lived longer. And there have been a number of studies. Some support that finding, others don't. But the overall studies indicate that good emotional support can actually enhance survival with cancer, which is surprising, but not that surprising. There was a study from out of the Dana-Farber Cancer Center published in the Journal of the Journal of Clinical Oncology, showing that all in all, married cancer patients live 4 months longer than unmarried cancer patients. And this is like a study of 700,000 cancer patients in the U.S. This is psycho-oncology. This is the fact that what's going on in your head has an effect on your body. It can help you live better if you handle it better, and maybe it even will help you live longer.
Are we willing to make the other side of that, saying that increased anxiety increases disease progression and mortality?
We think it can. So one of the other things we did is some psychoneuroendocrinology. So we looked at stress response systems in cancer patients. And one of our major stress hormones is cortisol. It's a glucocorticoid. It mobilizes glucose into the blood. And we normally have a diurnal rhythm of cortisol. It's highest for me about now, just after you wake up in the morning, and goes down throughout the rest of the day and then rises again at night. And it's very useful. If you need to fight or flee, you want more glucose in your blood so you can do it. On the other hand, if you keep firing off that system when you don't need it, you're expending resources and can do some wear and tear to your body as well. And we found that abnormal patterns of this glucocorticoid, cortisol, if they stay high, the pattern gets sort of flat rather than the peak and valley that's normal, that actually is a predictor of shorter survival. So the answer is yes. A maladaptive stress response can potentially hasten disease progression, whereas a good one potentially can lengthen it.
Super interesting, which brings me to some of your other research, the intersection of circadian rhythm and its disruption and its implication for, I believe the research was on breast cancer, folks?
Yes, that's correct.
What did you find there?
Right. We found that a disrupted pattern, and part of it I was already referring to, the cortisol pattern being disrupted, abnormal circadian pattern of cortisol predicted shorter survival. And this is years later. It isn't like, 3 days before you die, the pattern's different. This is years before. But the other part of circadian rhythm, David, that's very important is sleep and wakefulness. And we found actually that people with breast cancer who were inefficient sleepers, who had trouble getting to sleep or staying asleep, actually also had shorter survival. But the other way around is good sleepers live longer. It was having a long period of good 7 hours of consistent sleep at night predicted, and with fewer disruptions, predicted longer survival with breast cancer. A colleague of mine, Oksana Polish, took the lead on those studies. And so it suggests that, just managing your stress response during the day and getting a good night's sleep is a good part of therapy for cancer. And there's reasons why people may lose some sleep. I was just talking with someone who 2 years ago was diagnosed with breast cancer, and she found herself waking up at night in a cold sweat, very anxious. And she actually started using Reverie, our self-hypnosis app. And she said, I'm sleeping, I sleep through the night. No meds, I sleep better. So that's good for you psychologically, but you know what? It's good for your body too. Good sleep, as you know, exercise during the day and good sleep at night should be a part of everybody's health regimen, but especially cancer patients. So that's what we found.
100%. I mean, I tell people, if I don't care how many supplements you're taking, if you're not sleeping, you're sabotaging everything.
That's right. That's exactly right. It's good for your brain and good for your body to get a good night's sleep.
I'm curious about this intersection of heightened anxiety, trauma, disease, and then reduction of anxiety and possibly addressing past trauma through hypnotism or self-hypnotism.
Yes, hypnosis can be quite effective in helping people deal with trauma for a number of reasons. One of them is that when you're traumatized, you go into a kind of hypnotic-like state. You narrow the focus of attention, you dissociate things that otherwise you'd be aware of. And so we've learned that many kinds of treatments for post-traumatic stress disorder involve what's called exposure and cognitive restructuring. So the way you deal with it is not run away from the memory of the trauma, but you address it so that you don't feel attacked by it again. You're saying, I'm choosing to pay attention to this and I'm going to put it into perspective. And so you can use hypnosis as a kind of controlled entry, but also exit. The nice thing is you focus intently on it, but then you do some mental work about it and then you step back from it. So, and there's been a randomized trial of hypnotherapy for people with PTSD out of Israel, and it shows that, in fact, people recover more quickly. And I can give you an example if you want. I had a patient who was a lovely woman who grew up in a country that is not famous for being nice to women. And she said, I realized as a teenager that my body wasn't my own. Men could comment on anything they wanted to. It was terrifying. And I learned then that she had been raped by a landlord when she was 12 years old. And the family was afraid to do anything about it. They didn't want to be thrown out of the building and all that. So they finally got out of that country, came here. She became a healthcare professional, but she was chronically depressed. She retired work 15 years before she needed to. I initially was treating her for pain with hypnosis, and she got rid of the pain. It was from 6 out of 10 to 0 in one session. She was astounded by it. And then we started talking about this, what had happened to her and her depression. And her psychiatrist who's treating the depression had referred her to me. And I said, well, let's go back in hypnosis and relive what happened to you. And so I said, I want you to pretend you're your own mother to your 12-year-old self. And she starts to cry, and I have her picture herself right after she'd been raped. And I said to her, I want you to answer one question for me. Is this her fault? Did she deserve this? Did she do something? And she started to cry harder, and she said, I'm stroking her hair. I'm stroking her hair. This is not her fault. I'm stroking her hair. And she came out of it, and she said, I feel lighter somehow. I feel different. And about a week later, she called me up, and she said, my psychiatrist wants to know what you did to me because I'm not depressed anymore. And she said, my friends don't recognize me. And I just talked to her the other day. It's about 8 months. And she said, I've had one bad month, but otherwise I'm a different person. I feel different now. I'm not depressed. And so there are times when you can use states like hypnosis to intensely focus on and work through feelings. And of course, the problem with most sexual assault victims, particularly when they're children, is that they blame themselves for events they didn't control. The worst thing about trauma, about sexual assault, about the horrific things we've seen happen in Israel is it's not pain, it's not fear, it's helplessness. You're made into an object, and we hate that. Your agency is taken away from you. And so many children, especially who don't understand independent causation, figure if the world is fair, if the world is just, and this terrible thing happened to me, it must be something wrong with me that made it happen. So they blame themselves for things they didn't control. And so helping people just understand and face that period of helplessness, but see it not as something they deserved, but as something that was imposed on them, can be very helpful to them in putting trauma into perspective. And hypnosis can be very helpful with that.
Oh, this is a powerful story. Well, you worked a lot about respiration and mood, which is something we're going to circle back to that in a moment and talk about reverie because there's a lot there. But talk to us about, there's a phrase that I came across called cyclic sighing, which I guess is a scientific term for something that I commonly do, but explain to people, what do you guys mean by cyclic sighing?
Cyclic sighing. Well, it means literally sighing in cycles. And we all sigh. Our respiratory system is programmed to have a deeper exhalation from time to time. That the deep inhale helps to open up all parts of the lungs so that you get air circulating in and out, and you don't have some of these little alveoli, these little bubbles in the lung where the oxygen and carbon dioxide transfer happens, sort of remain collapsed so that they don't allow for air exchange. But after the deep inhale, this slow exhale is important. And part of why it is, we're used to saying, if you're anxious or tense, take a deep breath. Well, actually, it's the inhale actually tends to increase sympathetic activity because it reduces venous return of blood to the heart. If you think about it, you're lowering pressure in the chest. That's how you bring in more air. And so your heart senses a little bit less blood coming into it. And so the sympathetic nervous system says, you better start beating harder and faster. So there's just a bit of an increase. When you exhale, the opposite happens. You're forcing blood into the heart. It triggers parasympathetic activity that slows the heart rate. So there's this constant variation going on. But basically, exercises that emphasize a long, slow exhale are relaxing because heart rate slows down a bit. The parasympathetic nervous system goes into action. So if you want to calm yourself down, one very quick way to do it, and you can try it now, David, if you want, is you just inhale first using your abdomen. So diaphragmatic inhale through your nose, inhale through your nose, hold your breath, and now fill your lungs completely by expanding your chest. And now slowly exhale through your mouth. Slow exhale. Try it again. Inhale through your nose, halfway with your belly. Hold. Now fill your lungs completely. Slowly exhale through your mouth. How are you feeling now?
I'm familiar with this exercise, and
You are.
I love it. Yeah. It was actually taught to me by a gentleman I had on the show who was a former Blue Angel pilot who was in Top Gun. And
Wow.
they're experts at sympathetic, parasympathetic, being able to oscillate back and forth. And he taught me that. Yeah.
Right. Good. Well,
yeah.
It's surprising often how instantly relaxing it is. And that's one of the other exercises we have on the Reverie app now. And we published a study in Cell Reports last January that if we taught people in a randomized trial to do this particular exercise and some other breathing exercises that also help, like box breathing, which is inhale, hold, exhale, hold. The Navy SEALs do that before they go out on maneuvers. It's called tactical breathing. That we actually found that if people did that just 5 minutes a day for a month, their mood was better. They had more positive emotion. They were less anxious, and their average respiratory rate. So we had a whoop strap on them that measures their heart rate and sleep time and respiratory rate. Actually reduced. So their average breathing rate went down, which meant their sympathetic arousal was going down. So there are things you can do like that with not that much time, but just some regular practice that can help lower your overall level of tension and stress.
I'm going to ask you, since you're a doctor, I'm going to ask you a question about myself. I'm 65 now, and what I've found is over the last 10 years, I've developed a little bit of an essential tremor in my hand. But it's only when I'm either hungry or highly sympathetically activated. I also have this silly thing I do. I'm a ski racer. And if I do that for a couple hours and I come down and I'm both highly sympathetically activated and hungry, I can hardly hold a spoon. I'm just sort of shaking. And I try and bring myself down. And the neurologist tells me my basal ganglia are not functioning like the way they should. Any thoughts?
Yeah.
Tell me.
Yes, sure. Well, where do you get my bill, David? But
Fair enough.
Yeah, I think, look, in general, there are, sort of rhythmic discharges of all of our neurons all the time. But in general, the sort of fine motor skills are overridden by the general control systems that tell the hand to move and stop. And that your level of tension, which increases sympathetic activation, may sort of bring out some underlying rhythm that is not well dampened when you're really stressed and activated or hungry and seeking, nourishment. Your blood sugar may be a little bit low. And so it's a kind of subtle discontrol in the system that most of the time you can handle, but when you've got strong sympathetic arousal, like when you've been skiing and on a race, it tends to unmask that. And, I would say, I don't think it's anything to worry about. It's not a hell of a lot of fun, but things you can do to self-regulate. And it'd be actually an interesting experiment for you to do. When this is happening, after you've come down from skiing, do the cyclic sighing then.
Yes.
And see if you can slow that down. I'll bet you can.
I can. I was going to tell you that. This works.
Good.
Is where I was going with this.
There you go. Good. That's what I figured. So what it's showing is that you're unmasking a sort of slightly uncontrolled sympathetic arousal. And if you can just get the autonomic nervous system back in balance, you can control it. So it's not a hell of a lot of fun, but I don't think it's anything to worry about. And the fact that you have this, you can invoke this secondary parasympathetic control is a good thing. So, I would view it as something like the temperature gauge on your car. If it goes up, you know what to do to bring it back down. But it's interesting, actually, that you have that experience. But the good news is you can control it.
I'm friendly with a lot of high performing athletes and their coaches, and this can be trained.
Really? Huh?
Yeah. I've had Andy Walsh on this show. He's head of high performance for Red Bull. And that's sort of like sympathetic is their world, right?
Yes. That's right. Yeah.
But
well,
they train this. So after something happens, if you watch a really high performing athlete, they'll do their thing, and then there'll be like 30 seconds where they're doing this, where they're sort of bringing everything down so they can do their thing again. Because they can't, you can't stay at that high level consistently.
That's a good point. That's very interesting, and I'm sure that's true. And you want the arousal when you want it, and not when you don't.
Like the Navy SEALs. Right.
Yes,
they run through the jungle for 10 miles, all this stuff, and they're all jacked up. But now they have to focus, so they have to be able to like bring themselves down to do that.
That's true. Yeah, you want to marshal it so you've got it when you need it. The coach of the Stanford women's swimming team some years ago, we have a superb women's swimming team, but he noticed that they were swimming faster in practice than they were in meets, and that's not a good thing.
Right.
And what we realized was that they were getting distracted by worrying about what the woman in the next lane was doing. And swimming is not a contact sport, so it really doesn't matter what the other person. So I had them do self-hypnosis and just practice swimming their own best race, focusing on their communication with their body, just the kind of thing you're talking about, and having the feeling within their body that they were using their body as efficiently and as well as possible. And their times went up. They went down. They did it faster and better when they were just focusing on themselves and ignoring what was going on in the neighboring lanes. So that's another example of that.
We had Dr. Lauren Loberg on the show a couple of weeks ago, and she's a performance expert. Deals with a lot of athletes, but the conversation was around all of life is performance. Talking to my wife, I need to be able to perform properly. Going to the grocery store, like it's all, you're not necessarily an Olympian, but being able to perform properly and being able to focus like this and exactly what you're talking about, which brings me to Reverie.
Great.
So let's talk about Reverie. What is this?
Reverie is a digital interactive hypnosis app. I decided that, I've treated a lot of patients, about 7,000 in my career, but there are a lot more people who can benefit from managing their pain, stress, anxiety, insomnia, bad habits. And I wanted to make what we've learned available. And there are a couple of sort of tricks to it. And one is that all hypnosis is really self-hypnosis. So is it possible that people can just do it for themselves when they get the right instructions? And we built Reverie. Ariel Poehler, who's the co-founder of Reverie with me, came up to me after a Brain Mind Summit at Stanford and said, would you like to try and build an app that would do this? And at first I was a little nervous about it. What would happen if all these people out there were getting hypnotized and I wasn't there watching them, but I thought, why not? Because I don't really hypnotize people. I teach them how to use their own hypnotic ability. And so why shouldn't people be able to do that? But I wanted it to be as much like the experience in my office as I could. And that meant interaction. So, I give some instructions, I see how they're responding, I ask them, and then I make decisions about what to do next. So I wanted it to be like that. And he said, well, Amazon's Alexa is making this, interactive speech platform available. They want more people to use it. Should we try? Let me build you one. So we worked on that together. We started out helping people to stop smoking. And we found that 1 out of 5 people just stopped smoking using the app right away. So that's about as good as I get when people are sitting in my office and I'm doing it. And it's about as good as you get using varenicline or bupropion or nicotine patches as an alternative. So we began to see, it could work. But the app, it was a little clunky. And so we hired some great engineers, built up a little company, And we've got our own app now that works very smoothly and helps people get to sleep, get back to sleep, control their pain. I noticed you had a doctor on the show, Afton Hassett,
Yes.
who talked about pain control
Mm-hmm.
and that pain is in part, the way I like to say it is the strain and pain lies mainly in the brain.
Mm-hmm.
That brain is an interpretation of signals that come into the brain, and we found, as many other people have, with hypnosis, that you can control pain perception. You can make it worse. You can make it better, mostly better. And he talked about how the default mode talks with the salience network. Those are exactly parts of the brain that hypnosis alters.
Mm.
So we found when we hypnotize people that they can turn down activity in the salience network, the dorsal anterior cingulate. They can disconnect from the default mode network. So when they're engaged in the hypnotic things, they turn down activity in the default mode, and they reinterpret pain signals. So we find that about 3 out of 4 of the people who use it find within 12 minutes that they've been able to reduce their pain. And so we're viewing this as a way of helping people with stress, with pain, with bad habits, and a number of other everyday problems people live with, that Reverie can help them do it. And it's safe and effective. And, if you consider, David, the effect that, pharma like Purdue Pharma have gotten, hundreds of thousands, if not millions of people addicted to opioids, and that last year, 82,000 Americans died of opioid overdoses in the U.S. CDC's expecting 111,000 this year. It's horrifying. And, people are scared of hypnosis and they say it's weird or it's dangerous or something. We have not succeeded in killing anybody with hypnosis yet, but millions, hundreds of thousands of people are dying of opioid overdoses. And so the possibility, and in fact, the reality that you can control your pain using self-hypnosis is something everybody ought to try. It won't work for everybody, but it'll work for a lot of people. We're finding with Reverie 3 out of 4 people who use it for pain control feel less pain within 12 minutes. And, I had a young woman in my office who was 7 months pregnant, had bad lower back disease, and terrible pain. And she couldn't use drugs because she was pregnant. But the bigger the baby got, the more pain she had. And I got her hypnotized. She was quite hypnotizable. Her pain went from 7 to 3 in a few minutes. And she opened her eyes and she looked angry. And I said, "What are you angry about?" And she said, "Why are you the last doctor I got sent to instead of the first?" And so this is something that people can try. And if it works, great. And it often will. And if it doesn't, no harm, no foul. So I encourage people to give Reverie a try. You can download it from the App Store if you have an iOS phone, and from Google Play if you have an Android. And give it a try and see if it helps.
We'll put that link in the show notes. And for those that are listening, Reverie is Reveri. I went on Reverie, and
Great.
the first thing that happens is you take a test.
Right.
Are you the right personality type? I'm like A1 personality type for hypnosis.
The poet, huh?
Yeah. Yeah. Although, as I mentioned earlier, I have a degree in mechanical engineering, but not my personality type. So,
are you the kind of guy that gets so caught up in a good movie that you kind of forget you're watching a movie and enter the imagined world? Yes. There you go. There you go. So that's people using their natural hypnotic ability spontaneously. We call it absorption. And you get caught up in movies and a sunset and whatever else you're doing. That's a spontaneous self-hypnotic state. And so since you do it anyway, since your brain is configured to help you do it rapidly, deeply, and efficiently, why not take full advantage of it? Our major evolutionary advantage is this big brain that sits the 3 pounds on top of our bodies, but it doesn't come with a user's manual. We don't always know how to take full advantage of it. And this is a way of doing exactly that.
talk to me about hypnosis and the ability to change one's own mind.
I like that. That's true. Change your mind. Well, that's what hypnosis helps you to do. And one of the things it helps you to do also is to change who you are. The turning down activity in the default mode network and that's what happened. Experienced meditators do that over time. They turn down activity. The whole thing about meditation is getting over yourself, not focusing on yourself and who you are, but just on experience, on being, on letting feelings and experiences flow through you. And in hypnosis, you can do that very rapidly. You can just turn down that. That's why the football player will dance like a ballerina in one of those stupid shows, is that you can let go of who you think you are or what people think of you and just be something else. And the cool thing about hypnosis is you can surprise yourself by what you can be and become if you just try it, see what it feels like, because you're turning down the part of your brain that's sitting there saying, wait a minute, you can't do that. You've got to be having bad pain now because the doctor told you this is wrong and that's wrong. And instead, just what would it be like if I could actually control that pain? Or for you, if I could control that little tremor, and you can do it. And you're being very hypnotizable. It'll be easy for you to do that, exactly that, by managing your overall level of arousal.
It's really great learning about hypnosis, and why not try it, right? Because it's so low risk and it seems to be so effective.
Right. That's right. So give it a try. It's worth it. It helps, and we get people to focus on what they're for, respecting and protecting their body, rather than fighting an urge, which just makes it worse. It's like telling yourself, "Don't think about purple elephants." Are you dying for a smoke? Yes, I am. I think I'll have. No, it's you focus on your position of respect and protection for your body as if it were a baby, and people can 1 out of 5 stop. Most of the others at least cut down on the amount of cigarettes they're smoking. So yes, it can be very helpful. It's worth a try.
David, it's been great having you on the show today. It's really an honor and a pleasure. And congratulations on the launching of the Reverie app. I hope people get to try that.
You're most welcome, David. Thank you for having me.